ask Anne to take us through what tools are available to manage anxiety.
I think it's a great question. So what happens when it scales up? I will say that what you just shared with us about positivity, though, Linda, is so important and so valuable, and really kind of one of these foundational things that we can all rely on. And there's, as you said, a lot of data to show that a positive paradigm can really make an actual difference in how we're functioning. From my perspective, when I have someone in my office who's struggling with anxiety, I really like to start at the beginning. You know, that old saying, the journey of 1,000 miles starts with the first step. And even though these things are simple, they're not necessarily easy. But I do like to check in with, how are you exercising? Susan, you touched on this as well. How are you sleeping? How's your nutritional status? Those are sort of three pillars, three foundational pillars that all of us need to pay attention to, and provides a framework for a lot of our ability to be resilient and to deal with things like stress and anxiety. We talked earlier about training in resilience. You know, there are really active steps that we can take to grow that muscle. And mindfulness is also another very powerful tool. In fact, the research has shown that taking people through like a simple 8-week mindfulness training program, so you don't have to be, you know, a guru at the mountaintop. You can be just regular Joe Schmo like all of us, and learn how to become more mindful, more present, more aware of the present moment. The research, and this was with, I think, about 24,000 people over many, many years, coming out of the University of Massachusetts. The research showed that people were able to deal with stress better, deal with pain better, deal with chronic illness better. And a lot of it had to do with not so much changing physical disease so much, but rather the way in which they related to it. And the power of the mind and how we relate to our challenges can make a huge difference in how we deal with things like anxiety. Cognitive reframing is a therapeutic tool that we use in the therapy setting, in which we ask people to identify what I call automatic thoughts. And all of us have these automatic thoughts. We have sort of a knee-jerk set of reflexes that we tend to respond to situations and to challenges with. And oftentimes these are reflexes that we learned at an early age, because first to market, that's how we viewed the world. That's how we learned how to view the world. But sometimes what served us well when we were, say, 5 years old is not so good when we're 5 and older. And so if we can identify what we call cognitive errors, ways of viewing the world that are not so productive, then we can reframe them. Some very common cognitive errors would be things like black or white thinking. I don't know if anybody here has ever experienced that, where we tend to see it all one way or all the other way. We have a hard time finding that gray zone. Another very common cognitive error is the idea of personalizing. So if things go wrong, we tend to say, well, what did I do to contribute to this? Rather than perhaps looking at outside sources or outside circumstances that really don't have anything to do with us, that may be influencing the bad outcome. And another common cognitive error is that of catastrophizing. So we see something small going wrong, and in our minds we steamroll it, and suddenly, wow, there's a catastrophe heading our way for sure. And so that's where that strategy of coming back in with the positive emotions and the centering can really help bring us back on track, so that we can see it for what it is and perhaps reframe it a little differently.